Welcome back, and I am Andy McCrae, Scientific Director for the Annenberg Center for Health Sciences. My pronouns are masculine or anything respectful. And this is the third module in our series on creating a gender-affirming healthcare environment for optimal HIV care. In the previous module, we reviewed the shocking healthcare disparities experienced by transgender nonconforming individuals. Much of this is explained by the stigma and discrimination against trans people in our culture generally, including within healthcare settings. General misunderstandings about sexual orientation, gender identity, and expression, what we will refer to as SOGI, underlies stigma and discrimination. In this module, we will explore SOGI. We all have our individual SOGI, so let's develop a better understanding of it. The concept of the genderbread person was developed by Sam Killerman to illustrate the many forms of gender and its distinct differences. This infographic was used to break down gender identity into 4 continuums and to illustrate how gender identity, sexual orientation, biological sex, and gender expression are independent of one another. They are related but not connected. More on that later. Biological sex refers to the measurable organs, hormones, and chromosomes you possess. On the left, we have female, and on the right, we have male. Being female means having a vagina, ovaries, 2 X chromosomes, predominant estrogen, and you can grow a baby within your womb. Being male means having a penis, testes, and an XY chromosome configuration, predominant testosterone, and you can help make that baby in a female's womb. In the middle, we have intersex, which describes someone's sexual organs that are not strictly male or female. Being intersex can be any combination of organs, hormones, and chromosomes. For example, someone can be born with the appearance of being male, but have a functional female reproductive system inside. And then there is sexual orientation. On the left, we have hetero, meaning attracted to people of the opposite sex or being straight. On the right, we have homosexual, meaning attracted to people of the same sex or being gay or lesbian. And in the middle, we have bisexual, meaning attracted to people of both sexes. Sexual orientation is all about who you are physically, spiritually, and emotionally attracted to. If you are male and you're attracted to females, you're straight. If you're male who is attracted to males and females, you're bisexual. And if you're male who is attracted to males, you're gay. Pansexual refers to someone who loves sexuality in many forms. It is like bisexuality, but even broader. A pansexual person experiences sexual, romantic, physical, and/or spiritual attraction not only for traditional male and female genders, but also transgender, intersex, androgynous, and gender fluid people. Gender fluidity refers to the gender which varies over time. For example, a gender fluid person may identify at any time as a male, female, or any other non-binary identity. Asexual refers to the lack of sexual attraction to anyone or absent interest in sexual activity. Think of queer as an umbrella term. It is a sexual orientation label which advocates breaking binary thinking and seeing sexual orientation as potentially fluid. Queer is a simple label to explain a complex set of sexual behaviors and desires. For example, a person who is attracted to multiple genders may identify as queer. At a community needs assessment, I heard a young person state, "Why does it matter how I'm different, when I'm different, or why I'm different? Just let there be a place in the society for difference of any sort, and accept me any way that I am or am not. Accept me as queer." Being transgender does not imply any specific sexual orientation. Gender identity is not the same thing as sexual orientation. Transgender people can have any sexual orientation as shown in this pie chart. Binary norms persist even though Dr. Alfred Kinsey's pioneering research in the 50s uncovered that most people aren't absolutely heterosexual or homosexual. Kinsey asked people to report their fantasies, dreams, thoughts, emotional investments, and others, and frequency of sexual contact. Based on his findings, he broke sexuality down into a 7-point scale from 0 to 6. 0 was assigned to exclusively heterosexual. 6 was reported for exclusively homosexual thoughts, fantasies. People who expressed hetero and homo equally were assigned a 3. For people with predominantly heterosexual thoughts, but incidental or more than incidental homosexual thoughts, he assigned them 1 to 2. 4 and 5 were assigned for those who had primarily homo, but incidental or more than incidental hetero thoughts. Kinsey found that most people range between 1 to 5, with few being exclusively homo or heterosexual. As with sexual orientation, gender identity operates on a range of outcomes. On the left, we have woman, and on the right, we have man, two terms familiar to us all. In the middle, we have the term genderqueer, which, you guessed it, is used for an identity that is somewhere between woman and man. Gender identity is all about how you think about yourself. Do you think you fit better into the societal defined role of a woman or a man? Or do neither ring particularly true for you? Are you somewhere in between the two, or do you consider your gender to fall outside of the spectrum completely? The answer defines your gender identity. It has been accepted that we form our gender identity around the age of 3, and after that age, it is incredibly difficult to change it. Formation of identity is affected by hormones and environment just as much as it is by biological sex. Transgender is an umbrella term referring to an individual whose gender identity is different from their sex assigned at birth. Cisgender refers to an individual whose gender identity is the same as the sex they were assigned at birth. Our gender expression refers to how we present ourselves to others and how we are perceived. On the left, we have feminine, and on the right, we have masculine, the two expressive terms related to woman and man. In the middle, we have a term androgynous, which describes an ambiguous or mixed form of expressing gender. Gender expression is all about how you demonstrate your gender through the ways you act, dress, behave, and interact, whether that is intentional or unintended. Gender expression is something that may change from day to day, outfit to outfit, event, or setting. It is important to recognize that gender expression is how you present and how you are perceived by others based on culturally defined gender norms. We all fall somewhere on these interrelated continuums. Gender identity, gender expression, biological sex, and sexual orientation are independent of one another. They are not connected. So what do I mean by that? For example, a person's sexual orientation doesn't determine their gender expression. And their gender expression isn't defined by their gender identity. And their gender identity isn't determined by their biological sex. These things are related to one another, but they do not determine one another. If someone is born with male reproductive organs and genitalia, he is very likely to be raised as a boy, identify as a man, and express masculine. We call this identity cisgender, when your biological sex aligns with how you identify. And it grants a lot of privilege because it's how things are expected to be. But many people fall outside strict adherence to these norms. As healthcare providers, let's not treat transgender as some kind of outlier, but rather understand transgender people in a context that gender identity expression, biological sex, and sexual orientation varies widely, and that we all fall somewhere along these four continuums. We have a lot of terms and labels referring to where someone may fall on these four continuums of sex, gender identity, gender expression, and sexual orientation. This is not a comprehensive list, but it does represent commonly used terms. You can expect these terms and labels to evolve over time, and you can expect them to be used differently across cultures and across generations. Everybody has a SOGI, and it varies from person to person. Your SOGI may evolve over time. To be more inclusive and accepting, we need to be cognizant of the myths and misconceptions, how they can vary from cultures and communities, and how they can lead to preventable health disparity. Let's read this and think about what healthcare challenges these individuals may experience. Take this couple. The black-haired lesbian trans woman was born male, and she still has her male genitalia. She identifies as a woman. She expresses feminine. She is attracted to other women, which makes her a lesbian trans woman. The red-haired cis woman was born female and has the sexual organs of a female. She identifies as a woman, which makes her cisgendered. She is pansexual, attracted to male, female, intersex, queer, bisexual. She is currently in a sexual relationship with a trans woman, which makes them a queer couple. But because one has male and one has female sexual organs, they can still reproduce. At the end of this webinar, your entire organization should be able to enter into a meaningful conversation as to who are these people and what healthcare challenges might they experience. For example, the black-haired woman might need a prostate exam and a PSA test, but doesn't want to be addressed, treated as a man, or assigned a male roommate in a hospital, and certainly should not be told to go back to California. Bottom line, we need to treat the biological organs that remain and provide care for the individual according to the gender identity and expression. By the way, you may think this is an extreme example for a cartoon, but there are many queer couples whose gender expression and sexual orientation present unique healthcare needs.